Welcome to the Janey Lee Grace Spotlight Interviews. Please note that the views and opinions discussed are not necessarily those of the host and her associates. We recommend that if you have any health concerns, you contact your usual health practitioner. Enjoy the show.
Hi, it's Janey Lee Grace. Welcome to the Natural Spotlight Interviews. This is the second in the series. First one was fantastic, though I say so myself, and got a great reaction. And tonight's Spotlight interview is very, very exciting. I'm just going to give you a heads up that in the next few weeks and months, we are going to be covering all sorts of really interesting topics, all connected, of course, with holistic living or looking at a natural approach. So we're going to be looking at natural hair care, at how silica can help with hair and nails also. We're also going to be looking at digestive health. In fact, we've got a couple of natural living spotlight interviews, one with someone who is recommending probiotics. We have someone who works with changing gut bacteria, which is going to be fascinating. Someone who works with kefir. We've got a whole host of topics to come. So it's very exciting because I don't really think there's anywhere else you can hear this kind of stuff because well, it's not widely available, is it? We're going to be kind of asking some of the questions that people interested in holistic living and living consciously really want to know from the people who can really give us this information. So tonight's Spotlight interview is called Freedom from Allergies, and of course we're looking at the natural approach, and this is sponsored by David Stevens of Chirokinetic Therapy, and I'm thrilled to be able to welcome David to the call. Hi David, are you there?
Can you hear me?
I can hear you now, yes. That would have been an interesting call if I was going to have to do the whole thing myself.
Yeah, no, you'd have managed.
So David, before we get on to chirokinetic therapy and all of the really interesting work that you do, let's just get really clear on what an allergy is, because there can be a lot of confusion between the difference between an allergy and an intolerance. So can you just sort of briefly explain that for us?
Yeah, I think so. I mean, intolerances and allergies are very easily confused. An intolerance is usually classified by an IgG blood test, which people have. This gives a good indication of a variety of foods or other products to which the person is best to avoid. But, and where it gets confusing, that is quite often it is a combination of foods that we become too intolerant to rather than just one. An example of this is once I saw a man who had severe indigestion due to a food intolerance, but he was unable to pin down which part of his diet was responsible. Every day at lunch he had a cheese sandwich. Most days, and sometimes he didn't react, but most days he did react. And that was quite a problem for him because he had the same thing every day. Well, I tested him for both bread and cheese individually, no reaction, which had also proved negative in a blood test. But when I combined them in a cheese sandwich, he tested positive. But that still didn't explain why on some days after a cheese sandwich he had no reaction. What I found was, on the days when he didn't react, he had a cheese and tomato sandwich. So by adding another product, he was okay, which is really strange, and it's very difficult to find that sort of thing.
Right, interesting.
Yeah, but on the other hand, an allergy is quite straightforward. It's an IgE response, which in a blood test is measured on a scale of 0 to 6. No, or 0 rather, means no allergy present. 6 usually indicates anaphylaxis or allergic asthma. There is very little confusion with allergies, as the trigger substance is usually quite obvious. With hay fever, though, it is often a combination of allergens which trigger an attack. So that's really the basic difference between the two, if that's an explanation.
So I'm going to be, I'm thinking then that most people would sort of assume that a food intolerance is something that can perhaps symptoms can be relieved, it can be, in inverted commas, cured or sorted out over time, or at least one could try and avoid those substances. But with an allergy, the feeling usually is if you have an allergy, you have that for life.
Well, that's the feeling, yeah, you're absolutely right. And of course it can be absolutely devastating.
Yeah.
You know, everywhere you go, you have to be avoiding peanuts, for example. And you only need the faintest trace to go into an attack, so that's quite different.
Yeah. So when we look at the amount of people suffering from allergies, I mean, it's quite incredible, actually. I was reading something the other day that said 12 million British people suffer from allergies caused by triggers in their own homes. Well, that's just one aspect. What's your view of sort of how many sufferers there are?
Well, I mean, I don't really think anybody knows, to be honest. I mean, my view is that it seems to be incredibly large, but that's probably my view. But it's certainly not a small number. It's very, very, well, it's an epidemic.
Yeah, yeah. And certainly it must have a huge impact on the economy as well, because people presumably need to take time off work.
Yeah, they do. And I mean, the NHS alone probably spends something like £1 to £1.5 billion a year on allergies. And on top of that, you've got, as you say, the days lost for work.
Yeah. Now, we're obviously going to talk much more about what you do in a while, but just to sort of set the scene, can you just give us a short sort of description of what it is you do, and indeed how you came to do it, why you founded it?
Oh, right. Well, it all sort of started when I was still training, and I had a nephew who had the odd asthma attack, and I thought it was an allergy, but I was wrong about that. So I tried to cure it on that basis and didn't get anywhere. And it wasn't until the head of our college, Hugh Corley, afforded me a sort of audience and gave me a lot of information on neurological pathways and all that stuff. And a friend of mine, John Melrose, who's got 50 years experience as an osteopath, naturopath and homeopath and herbalist. And what he taught me was, and it's really important to me, is that everything that occurs in the body is both logical and simple. And if you find it confusing, it only means you don't understand it. On that basis, I sort of moved forward on the allergy front and finally came up with the CKT treatment.
Okay, and just explain to us then, what does CKT stand for and what kind of treatment is it?
Chirokinetic therapy, but everybody calls it CKT.
Yeah, and what kind of treatment is it? I mean, we should probably stress, that it's non-invasive. We should say that from the off, shouldn't we?
Well, it's so non-invasive, the only thing people need to take off is their shoes.
Okay.
Apart from that, they're fully dressed, they're lying comfortably as possible on a bench, and then we proceed to make a series of tests using a specific muscle test. And then what we're looking for is the underlying cause beneath the allergy. Okay.
Well, now I thought what we'd do before we go any further is just get the view of someone from the medical profession. I wasn't able to find a GP, but we do have a doctor who's willing to speak to us. Unfortunately, he wasn't able to be live on this call, so this is one I made earlier, as it were. So I've pre-recorded this. So listen carefully because he's going to ask you a question, David. So this is Dr. Lawrence. We're just going to play this one in. So I'm delighted to welcome on the line Dr. Lawrence Church, who's a consultant psychiatrist. Lawrence, thank you so much for joining us on the call. I know you couldn't join us live, but thank you for being here.
That's a pleasure, Janey, yes.
So now I know you don't have any specific expertise in the field of allergies at all, but it's just really good to be able to speak to someone from within the, if you like, standard medical profession to just ask, how open would you be generally to sort of even investing in what might be classed as an alternative or complementary treatment or therapy?
Yes, I mean, certainly from my point of view, when I'm working with people, it's important to know if they're undergoing any other treatments, and indeed if those are alternative treatments and other holistic therapies as well. From my point of view, I'd say that there's very little in the way of things that are really contraindicated, or where the conventional medicines and treatments that I would be using really are at odds with other treatments that people might be, you know, exploring and benefiting from. So there's very few occasions that I can think of where we're really quite cautious or concerned. Often I'm in the position where I don't know enough about the alternative treatments, and that's really my ignorance. So I have to go up and do some bookwork and find out a bit more. And often it's nice to be able to talk to the practitioners who are treating the patients that I'm also seeing. I suppose the only caveat and the only little additional one is St John's Wort's, which is commonly used as an antidepressant. It's important not to mix that with other antidepressants that might be prescribed medications. And indeed, my general feeling is that one should be very careful with those sort of interactions because they are quite proven to be potentially risky. But otherwise, I'm very open and quite interested in knowing a bit more about these.
Do you think your view is sort of standard across a lot of consultants and doctors, or are you quite unusual in this?
I think as a relatively younger doctor, I qualified in the late 90s, so I've been practicing now for about 15 years. So I suppose what I'd say is I don't think my views are unusual in younger doctors. I think perhaps more senior doctors who qualified perhaps for longer periods, without being too generalising there, without forming too many stereotypes, but my general experience has been that they can be a bit more dismissive of alternative practices, whereas I think younger doctors are a little bit more open-minded and welcoming of them.
Do you think that possibly, I mean, I don't mean this as a personal criticism to you, but one of the things that gets levelled a lot is that within the medical profession, doctors and consultants tend to look at the one issue that's being presented, the one symptom, if you like, rather than looking at that holistic picture. Do you think that that's changing? Do you think that doctors are becoming more aware that something might have an impact on something else, even if it doesn't seem necessarily connected at first glance?
I think so. I think there is quite a difficulty, particularly in the way that medical training's going, where you've got very, very specialist knowledge being developed, and junior doctors training now after graduating out of medical school are increasingly encouraged after a sort of a relatively short period of time to pick a specialty and go down that training route quite quickly. So there is a danger that people get quite limited and very specialised in their knowledge in hospitals, whereas obviously in general practice, by very definition, that's much more general. So holistic approaches should certainly be the mainstay for general practice. But even in hospital medicine, I think we need to be quite careful with that sort of approach, that we don't get too siloed into our one specialty.
Well, that's really encouraging. I'm really pleased to hear you say it. So, as you know, our show this evening is all about freedom from allergies and treating them successfully from a completely natural approach, which, as you know, David Stevens is the founder of chirokinetic therapy and has had some, really quite remarkable success stories, actually. So I know you couldn't join us live on the call tonight, but thank you for being willing to pre-record this. Is there anything you'd like to ask David, and we can put that question to him?
Yeah, I mean, one of the questions I wanted to ask David was around the emerging evidence base for his practice, because we've certainly got to be quite robust in showing an evidence base for the treatments that we offer, both certainly in my area in terms of medication, but also psychological treatments and psychological interventions. They have to be quite robust and evidence-based. So I was going to ask him a little bit about certainly what the evidence base is so far and what efforts are being made to expand that and to come up with further evidence for these treatments.
Okay, well, we'll certainly put that question to him. I mean, as a complete layman, I would say if we have several people, call up this evening who say that David's treatment has worked for them, empirical evidence, as it were, does that count?
They count. They're good. They're called case reports, if you like, and if you get multiple ones, that's great. What we'd really love to see is I suppose, some sort of randomised trials and that sort of thing, so we can compare, patients who are similar, and so those that get treatment versus those that didn't have the same that treatment, to see how they compare in their outcomes would be really good.
Great. Okay. Well, we'll put your questions to David Stevens. Dr. Lawrence Church, thank you so much for joining us. Really appreciate your time.
That's a pleasure, Janey. Thank you.
So there you go. So David, hopefully you heard that question. What would be your response?
Well, you see, there's a huge difficulty with the sort of thing that I do, and which is based on empirical evidence, as he suggested, and it is. And you could say, in a way, I've got a PhD in results because there are so many people that have benefited. But when it comes to doing a randomized trial, I tried this about 10 years ago. And to cut a long story short, you need at least 100 people. You need 50 getting a placebo, 50 getting the control group, and then you compare it afterwards. There has to be a protocol, a rationale, and it gets very complicated. Not only that, you're looking at spending something like 150 to 200,000 pounds.
Wow.
And I couldn't do that.
That's interesting.
So actually getting that sort of scientific as opposed to empirical evidence is really very, very difficult. And even when you've got it, what are people going to say? Who paid for the trial? Oh, he did. Oh, right, and it came out in his favour. No, I don't think so. Yeah. It's just not a goer. It's a shame.
You were telling me, though, I think you told me that you did have some kind of evidence for what, or you did your own trial of some kind.
Oh, yeah.
Can you remind me of that?
Yeah, back in 2003-04, what I did was I invited 10 people with anaphylaxis to take part in the trial, and they were all treated. And they were blood tested before and after. And, well, I mean, apart from one person who never came back to me, everybody was allergy-free. So that's 9 out of 10. And I think the 10th person would have come back to me if she was still experiencing her allergy.
Well, one thing I wanted to do as part of this call is invite the opportunity for people to ask you questions live on the call. So if you're joining us online, you're very welcome to type in a question. We have a few already, but also we have a few callers. And by the way, if you are on the phone, on the telephone, what you have to do is you have to press star and number 2, and what that does is it raises your hand, if you like, and then I can see that you want to speak. So I can already see that Basil, if you're there, you'd like to talk to us. Basil, can you hear me?
Yes, I can hear you. Can you hear me okay?
Yes, I can. Brilliant. Thank you. Thanks for joining us. Now, I understand you've had experience of working with David.
Yeah, absolutely. In fact, I'm still undergoing my treatments with David, but I can assure you that the results so far are astounding.
Wow. Well, we haven't paid you to say this, so you better tell us your story then. What kind of allergy or intolerance do you have?
I actually have a very severe hay fever allergy, which is certainly quite common in the UK. But I am actually allergic to grass pollen, tree pollen, grain pollen, and dust, it seems. So I actually have quite severe hay fever symptoms from around April all the way through to the end of September/October.
Gosh, so really quite debilitating. So what was the prognosis from from your regular kind of GP then when you rocked up with this?
Well, I've had this situation since childhood, and as far back as I can remember, and certainly I've gone through every antihistamine I think known to medical science. None of them work for me. In fact, over the last 10 years, I've been using very, very strong steroid-based tablets, and indeed having the very strong Kenalog steroid injections. Now,
right.
I don't know if you know of those types of chemicals, but certainly the Kenalog injections, my GP advised that I was only allowed to have 3 of those in my lifetime. I can assure you, to get any sort of regular relief, I've had well in excess of about 20 of those injections, 2 or 3 a year, just to get any sort of relief for a month, just a couple of weeks at a time in most cases.
So what happened when you first heard about David then, or first went for a treatment? I'm guessing perhaps you were sceptical at first.
I don't think skeptical really covers it. I was pretty much laughing out loud. Sorry, David.
David, you're online. We can hear you, so
Yeah.
don't swear.
So,
Yeah.
so I mean, and David knows this. He saw the skepticism in my eyes. I was recommended to David by a very, very good friend of mine, who is also an associate of David's, and explained to me how David cured this gentleman of his allergy to prawns. And I said, well, if he can cure this gentleman of his allergy to prawns in a few sessions, what can he do with my hay fever? And this year, for the first year in a very long time, none of my other treatments were working at all. So I thought, well, I've got nothing to lose. I'm in a dire straits. I was really getting to a point of almost being hospitalized with the symptoms that I was facing with my hay fever. I wasn't allowed the Kenalog injection anymore, and none of my steroid-based tablets were actually working any longer.
Gosh. So how many treatments have you had with David, and what was the experience like?
So, as David has explained, completely non-invasive. My first treatment with David, I had the highest level of skepticism I think I could afford. I laid on his bench, shoes off, as stated, and he proceeded to try and find out what things I was allergic to, or certainly what things I was reacting to. It's the trigger points he was interested in rather than the symptoms, which makes complete sense. So he started to give me little vials that contained various types of pollen to hold in my left hand, whilst he touched me and pulled my right arm in what I considered at the time to be a rather weird and wonderful way. But he was certainly getting answers from that action. And long story short, he ascertained that I was allergic to all of those various elements and a combination of them, which is why I was having such an issue. And he also ascertained that the issue was actually caused by my childhood vaccination, which was astounding. And it seems that, and David, do forgive me if I get this wrong. My memory does play up sometimes, but
I forgive you.
He stated that my brain waves was out of alignment with my immune system, and that was caused by the shock to my system caused by my vaccinations as a child.
So how many sessions have you had in total?
3 sessions in total.
And are you clear of this now?
Well, I don't know if you can hear the background, but I'm actually sitting in my garden talking to you on Skype on my laptop for the first time ever.
Wow, that's fantastic. So you must feel very freed up then.
Freed up doesn't really come to even come close. I feel completely I don't know. I don't know what you would call it.
Liberated, perhaps.
There you go. Liberated.
Allergy free. How about that? Well, listen, Basil, we really appreciate you calling in. It's it's just great to hear it from somebody who's really had such an amazing recovery. Just fantastic. So thank you, Basil. Thanks very much. And David, hay fever obviously is a really big one, and particularly at the moment there seems to be well, I mean, I've suffered a bit of hay fever this year, and I've never had it before, and there does seem to be so many more people suffering. So what's going on there?
Well, it's a strange one because you meet people that have lived abroad, and they come to this country when they're about 40, and within 2 weeks they've got hay fever, and they didn't even know what it was.
Yeah.
But there's something about this country and the combination of pollens which is quite devastating. It's really quite amazing, and I think possibly it's because so many of us are keen gardeners, even if we've got a pot plant, and we go down to the garden centre and find another plant which is another hybrid, and that gets introduced into the mix, as it were, and you get this combination of pollens which has devastating effect on so many people. Yeah. And it is really endemic. I mean, it increases every year as far as I can see. But, I mean, that guy, Basil, is such a lovely guy. And, skepticism wasn't it? He looked to me as if I was some sort of wizard or witch or something.
I guess ultimately, even if you're sceptical, I suppose if something works, ultimately you probably don't mind too much if you've suffered all your life.
That's right. Yeah, I mean, they talk about psychosomatic, the people think you're going to get them better, so you do. And of course, nothing could be further from the truth, because people think that they're wasting their time, really, but they've got nowhere better to go, and they get better.
Yeah, fascinating. We've got quite a few cool questions coming in, so let me just throw one at you now. This is Vanessa, who says, when you're treating a serious allergy, like peanuts, for example, do you give patients any particular advice? Well, actually, if I could just add to that question, let's ask you first. Another question that came into me earlier was, does it require a blood test or a skin, like a prick test? How do you determine initially?
Yeah, that's right. No, we don't use any of those features. What we use is a very simple muscle test. We test a group of muscles that, well, just to keep it short, go from the base of the skull right down to the sacral area, you know. And that gives us a complete, I find it totally reliable. I know it's frowned on by the medical profession because they think it's hocus pocus, but truly it isn't. I mean, it is just brilliant.
So to answer, yeah, I mean, but sorry, no, I was just going to say, you know, to answer Vanessa's question then, because I can kind of see where she's coming from with something like a peanut allergy. I mean, that must be one would be. I mean, it's okay for Basil to kind of go and sit in the garden, but it must be terrifying to kind of come away from. You know, maybe you have said you've hoped you've successfully treated it, but what would be the advice? Would you say go and eat a peanut or not?
No, I would say definitely don't. I mean, what we say is that whatever the allergen was, don't seek it out. I mean, there's no point in eating a peanut or going for peanuts just because you're now allergy-free. It's silly. If, on the other hand, you do come across a peanut accidentally, which happens, then it's nice to know the sort of sword of Damocles is no longer hovering over your head. You're not going to go into a reaction. But don't seek it. That's silly. And it doesn't, just because you're no longer allergic to a peanut, doesn't make it a good food.
Yes. Well, we've touched on hay fever then. We might come back to it in a while as well. And I'm sure we will come back to things like peanut allergies. But on that note of people suffering from allergy, I mean, I know all allergies are debilitating, but another patient of yours, Helen, who again was not able to join us live on the call, unfortunately, but thank you for putting me in touch with her, and she was willing to speak on the telephone to me earlier as well. So we're just going to hear from Helen now and just see what she has to say. On the line we have Helen Robinson. Helen, thanks very much for joining us. Can you tell us your story?
Okay, well, first of all, thank you for the opportunity to tell my story. I became, was it intolerant, was it allergic, to both eggs and coffee. Eggs was a particularly difficult thing for me in terms of having to read every package, and having quite a severe physical reaction spread over 5 days, including highs, depressions, evacuation through every orifice that I could evacuate through. The coffee, however, although it was in many ways a less severe physical problem, it was tantamount to an asthma attack. It was affecting both my work and my social life.
It's very unusual, isn't it? A coffee allergy?
Yeah, and it was even the smell of coffee.
Oh, goodness.
So it meant that commuting became a nightmare. I couldn't go to meetings that I probably needed to if I was peripheral to the meeting, but I wanted to make a point at a meeting because nobody in the room could drink coffee. Also, I was thinking that I was going to have to give up my very long-term hobby of playing bridge because, again, people drink coffee. So desperate for anything, I was obviously happy to take anybody's suggestions for any kind of therapy, and a friend of mine suggested going to David, and I thought, well, I've got really nothing to lose, so I went to see him.
Had you ever had any other kind of alternative treatments, complementary treatments at all?
No, I've been through the system, and if I may say, I'm just being brought in a cup of coffee, which I'm about to drink.
Oh, wow. Actually, let me just ask you, before you tell me about your experience when you saw David, how were you, when you went to the doctor about this, what were their suggestions? I mean, how did you determine, I mean, obviously the allergy was obvious, but I wonder whether they did an allergy test for you, and I wonder what the suggestions of the medical profession were generally.
Well, I'm sorry to say that at the time I was both a smoker and overweight, and so I got the usual reaction,
Ah,
which is give up smoking and lose weight, and I'm sure you'll be better. Um, Added to that, though, the medical profession is about trying to avoid what gives you the problem rather than trying to alleviate the problem. So yes, I had been to an allergy specialist, but hadn't really got anywhere positive with
right.
that. So it was, as I say, a question of go away and make the best of it if you can,
Gosh.
which a lot of people have to do. So that was that. But and I was open to complementary therapies. I had been to an acupuncture specialist for a previous problem. So as I say, I went to David, and he has a wonderful approach. He doesn't seem to judge anything or whatever. He just coolly, calmly talks to your body, which is bizarre. I will say to anybody that it's not so very long ago that he'd have been burnt at the stake as a witch.
Absolutely, yeah. Many of us
Um,
along with him.
yeah, it just seems peculiar. But one of the keys, I think, to CKT is you don't have to believe in it. You have to believe in it to the extent that you're prepared to
You're
go.
prepared to rock up, yeah.
But beyond that,
Wow.
you don't have to believe it. It just happens. It works. And if it works, why knock it?
Yeah.
So, and I believe very, very strongly for allergies that it ought to be in the future that if you go with hay fever, with whatever kind of allergies, instead of being told, okay, well, I'm going to book you an appointment with a practice nurse for you to have your annual injection of whatever it is, or here's a prescription for whatever it is, that the first step would be, and David himself will say that he's not going to get 100%. There will be all sorts of reasons, and the medical profession will have all sorts of reasons why they're not 100%. But the first port of call, if you've got an allergy, is to go to see the practice nurse who will administer CKT, and hopefully that will be the end of that.
Gosh, that's some kind of dream world. Hey.
Well, I know it's a dream world,
But we can hope, yeah.
we
But
can hope.
so how many sessions did you need, and how did you first, well, I suppose what I'm wondering is, how did you know that it was going to be okay for you to try an egg? I mean, obviously you would know whether the smell of coffee affects you, but you must have been terrified the first egg you ate, if you did.
Yeah, well, yes, and I still probably wouldn't, by choice, have an omelette for a meal.
No.
I think I probably just forgot to read a packet. And I think David would say that that's typical. You relax, somehow, subconsciously you're going to want to try it. And, I'm quite happy with a quiche or something these days. I think that the stresses and strains, which may be what triggered allergies in the first place, may mean that you want some repeat visits. The initial treatment, I think, was 2 or 3 visits.
Yeah.
I have used it cynically. I think that probably what triggered the major reaction was a yellow fever vaccination, which is, of course, cultured on egg.
Ah.
And when I needed to update my yellow fever vaccination, I booked the appointment for the yellow fever vaccination, and for about 2 days later, I booked an appointment with David.
Mm-hmm.
I had the yellow fever vaccination. I had completely liquid insides until I went down to see David, and he sorted it.
Right.
Now, that's as I say, is a bit of a cynical use of it, but he's, it's available to anybody who's got an allergy to try it, is my view.
So I suppose what you're saying then is that there obviously clearly with you is a reaction to egg that can't necessarily be, in inverted commas, cured,
Yeah.
but most certainly can be successfully treated so that you can tolerate it, within reason.
I think that's exactly right. It can't be eradicated, but it can be mitigated.
Yeah.
And I wouldn't, again, say that I would expect it necessarily to be a lifelong mitigation. I think I might need a booster from time to time. I'm sure I do need a booster from time to time.
Yeah. Yeah. And as you say, with the coffee, which is an unusual one, you're now drinking a coffee as you speak to me on
I'm
the
drinking
phone.
coffee as we speak,
Well,
yes.
that must be incredible. That must have totally, changed your life, literally.
If you like, that's the really life-changing one, because it affected other people.
Yeah.
You can read a packet for yourself, but to say to somebody else, and believe me, in winter, when I needed the window open, if they were going to be drinking coffee in the same train as me, I was not popular.
Great. Well, Helen, thank you so much for sharing your story. It's really, really helpful, and I really appreciate you taking the time to do that. Thank you so much.
Thanks for listening.
So, David, what a story. What a
Yeah,
story,
that
my
was a
goodness.
good one. Well, I mean, after the first series of treatments, she was allergy-free for 10 years until she had a second yellow fever jab, which just had that effect on her, and the allergy came back. But it only took, I think it was 2 treatments, and she was free again.
Yeah. I've had one question in from Sally, who says she has had an allergic reaction to prawns, and she thought it was an anaphylactic shock. And she says, could this be reversed, or basically does she have this for life? And could you maybe just explain for anyone who's not quite sure what happens when someone experiences an anaphylactic attack?
Well, I mean, there are various of degree, but I mean, often, people experiencing this reaction actually die of circulatory shock within a few minutes unless they are treated with norepinephrine, which they get from an EpiPen device. But I mean, the problem there is that if it's your first reaction, you're not going to have an EpiPen device because it won't have been prescribed because you won't have had an attack. And also, I've come across people like Christine, who was so allergic to the bee venom that she was advised to carry 2 EpiPens and then told, but if you do get stung by a bee, you won't have time to set up the second one. So she was in a parlor state. And fortunately, treatment worked for her. But I mean, it's because there's a rapid decline in blood pressure due to the dramatic changes in the circulatory system. The veins and the arterioles, the tiny arteries, dilate, they become enlarged, and the increased permeability in the capillary bed allows fluid to build up in the tissue instead of being returned to the systemic system. And there's other things to it as well, which go on, which we don't need to go into. It's really unpleasant. Yeah. But after a CKT series of 4 treatments, because I like to get 4 negatives, 9 out of 10 people can no longer go into an anaphylactic attack. The body is not able to, and that's because we define and treat the underlying cause, not the trigger substance. So
when you say underlying cause, I mean, surely if someone suffers, if they're prone to having an anaphylactic attack because of, let's say for the sake of argument, a peanut allergy.
Yeah.
That is the cause, isn't it? If they come into contact with peanuts again.
Well, it's a way of looking at it. Actually, I don't consider it to be. I consider that to be the trigger. The underlying cause is something quite different. And what I find is that the underlying cause is a dormant virus which is residing in one or more organs, usually the hypothalamus, but more often the thymus. And this skews the immune response, causing the person to go into an anaphylactic attack with a trigger substance. Do you see the difference?
Yes. We've got lots of callers actually on the line, and I don't know who you are, but if you would like to ask David a question, or if you would like to speak to us, if you want to just press star and 2 on your telephone, star and then number 2, and then I can unmute your microphone. Hi there. Your phone number ends in 837, but I don't know who you are. Hello?
Hi, my name's Simon Odom.
Hi Simon, how you doing?
Hi, I'm very well, thank you. Yes, so David treated me many years ago now for a nut allergy.
For what?
For a nut allergy.
Oh, great! Exactly what. Well, I mean, not great for you, but exactly what we've just been talking about. Oh, fantastic! So tell us your story then. This is very interesting.
I think I've actually forgotten precisely how old I was. I think I was about 23, 24, and strangely, for the first time, I had a Brazil nut. Someone had given me one for a because I didn't actually eat nuts just because I didn't like them actually. But someone said try a Brazil nut, so I tried one, and I went into very quickly into an anaphylactic attack and was sort of rushed off to hospital for more or less the night. I discharged myself about sort of 1 a.m. Because the hospital wasn't particularly a pleasant place to try and sleep when you're recovering from it. But I had all of the usual reactions, which were sort of your tongue swells up and your blood pressure drops, and sort of I did nearly pass out, and I came out in hives, and I was pumped full of I think it was steroid and antihistamine and something. I was a bit out of it as they were still working on me, but it was extremely unpleasant and quite terrifying. And although I clearly knew what had caused this reaction, because it was blatantly obvious, it took about 4 months before I got tested by a specialist to sort of identify what I was actually allergic, what they then sort of said I was allergic to and what I wasn't. And I came back as extremely high reaction for Brazil nuts, although I was allergic to others as well. And I was given an EpiPen kit and told to, well, effectively just have to deal with it, which is quite scary, because you having had this awful reaction and really not wanting to go through that again.
Yeah, very frightening, because nuts are in everything, aren't they?
Yes, it's quite. Yes, it's quite frightening. It's very frightening, and it sort of makes you, very cautious about what you're doing and what you're eating. But I then, by fluke, I read in a local newspaper that David was doing a trial for this new therapy that's, well, it was new to me, and I think it was still relatively new in development. And he was looking for volunteers to come and try this. And so I volunteered because I was very keen to try anything that might help. And I remember we had about 4 or 5 sessions of what I found was a very strange, completely harmless, but it's a very strange process to me, in that it sort of a couple of sort of flicks and taps, and you were sort of started to, this was your treatment, and that was it. So it's totally painless and quite strange, but seemed to work extremely well, because after the treatments I went and had another round of blood tests, and they came back severely, very, very down on what they were. So whereas I was sort of top scale for a Brazil nut, I was down to about a 1 or a 2 on the scale, which was a massive improvement, and would take me well out of the danger point for anaphylaxis. So I was extremely pleased with that. I have to say I still don't eat nuts, because I just don't want to. I use it as an insurance policy rather than a sort of fail-safe.
But at least you don't live in fear.
Yes, it definitely took away the fear.
Fantastic.
Because that was a very strong fear, actually. And I was glad to be rid of that.
Yeah, great.
And I've been sort of clear. I haven't had an attack. I only had the one, and I've been 10 years on. Still nothing. So I was extremely pleased.
Simon, I really appreciate you calling in. Thank you so much. It's really good to hear your story. Let's go to another pre-record that we did, which is yet another person singing your praises, David, who couldn't be with us on the call tonight. This is Peter Dunn. Let's hear what he has to say. So we have on the line Peter Dunn, a marketing specialist. Peter, tell us your story.
I first encountered allergy problems in the late 90s, when I started to get very bad eczema. I'd had hay fever as a child and similar sort of things, a little bit of asthma, but that had all sort of died down. And then suddenly I started getting terrible eczema. And my wife stumbled across David Stevens' clinic in Leatherhead, near where we lived in Ashford. And I went along to see him, because at that point I was, trying steroid creams and stuff that really you shouldn't be having, but it seems to work in the short term. And David did this remarkable test, which has evolved a lot since then, but he basically challenge tested me using kinesiology, which I'm guessing people will be familiar with. But you hold a sample in a test tube in your left hand, and then he sees if he can move your right hand away from the side of your body. And anyway, it turned out that I was allergic to about 2,000 food substances, and
Oh my goodness!
And actually water as well. So I said to David, so that's great. I've got to kind of avoid everything. And he said, no, sit up. So I sat up, and he did this exercise where it felt like he sort of flicked my spine with his fingers in about 3 places, and then he left me to rest for a few minutes, and then he retested me, and I was everything I tested negative for, I was suddenly positive for. And all I can tell you is that within a month, the eczema was cleared up. I was absolutely fine. And I asked him about it. I said, how does this work? And he said, well, he said, in my head, it's sort of your body's running on a software system. And over time, the software is undermined by viruses and by electromagnetism and pollution and exhaustion and stress. And he said, I've just reset the software. I've just rebooted the system. And so for me, that was actually quite a clever analogy. And it's one that I kind of always work with when I'm describing it. And I've been going ever since. I don't see him as often now, mainly because I now live 3 hours from London, but secondly, because I go when there's something I need to be seen for.
So you must have been quite sceptical. Was there, there may be people thinking, well, perhaps the eczema was just going to be clearing up anyway, and it's not like you had a really serious allergy whereby you would have to go and test out whether you could have a peanut.
That's true. All I would say to you is I've had the eczema for several months at that point, and I looked like a human scab. And it was very distressing and uncomfortable. And, the NHS, God bless it, wasn't really doing me any good. I wasn't sceptical because I'd had very good treatment and results with acupuncture. So I've always been sort of open to a holistic approach. And actually, I know David, I've got a cousin whose child was allergic to wasp stings, and they always had to carry adrenaline. And after seeing David, he would never, ever be arrogant enough to say he had cured anybody. But I can tell you that child no longer tests positive for allergy to wasp stings.
Wow.
And so it was very easy for me. But actually, because the way the technique works, once David taps you, which is how I would describe what he does to reset the software, he then leaves the room because he says that he's initiating a healing protocol in your body, and that for him to stay in the room would interfere with that process energetically. So you do have to kind of get off the ledge a bit in doing this. And the only 2 people I've ever recommended to him out of the dozens and dozens I've sent to him, the only 2 people who had a problem with it were those who had a background in traditional medicine. They couldn't understand why they were paying someone to leave the room. They kind of wanted him sitting there paying attention. But everybody else, it's been fine for. Results have been extraordinary.
Peter, I really appreciate you taking the time to tell us your story, and it's really much appreciated. Thank you so much.
That's my huge pleasure.
So, yeah, another satisfied customer. I've got quite a few questions coming in for you, David. This is from Bev, who says, what about something like celiac disease, which of course is a disease? Presumably there's no reversal for that.
Yeah. Well, I have found in the past that I'm not being derogatory about this, but I have found in the past that several people that have been diagnosed with celiac disease actually didn't have it. But anyway, that's not the point. The people that I have treated, and there haven't been that many, with celiacs have improved.
Good.
But it is particularly nasty.
Another question here. I don't have the name of this person, but she says she had a reaction recently. I don't know whether she means an anaphylactic shock. She said, I thought it was from eating out in a restaurant, So I used my EpiPen. So this is obviously someone who has recognised allergies. But then she says she saw a kinesiologist who told her that it was actually from eating, I shouldn't laugh, it's not funny, but told her it was from eating from eating bananas. And so it was a kind of a one-off.
Well, that's very unusual. Yeah, that's very, because mostly things that trigger anaphylaxis are proteins. I mean, it's nearly always nuts, fish, occasionally meat, but not terribly often. And like when somebody has an anaphylactic attack to apple, it's quite often the pectin around the pips rather than the actual pulp of the apple. So for someone to go into anaphylaxis for something which isn't a protein, mind you, it happens with latex allergies, I must say.
Yes,
I don't know whether that's a protein, but
yeah, that's interesting you mentioned that, because I saw that report in the newspaper just recently. There's a woman who she had a terrible problem triggered by roadworks, because of course latex allergy is particularly nasty because latex is sort of hidden in so many things. Presumably that's quite unusual. Is it a latex allergy or not?
Latex allergy, well, if you go back, I don't know, 35, 40 years, there'd only ever been one recorded case. It was a real rarity, and now it's something silly like 1 in 4 of the health service providers have to have hypoallergenic gloves.
Gosh, is that because of greater exposure to latex in so many products then?
I don't think so. I think people used to wear rubber gloves day and night sometimes. If you go back to the times when they still do their laundry on a Monday in the boiler and all that. No, I don't think so. It's something else going on in our populations, particularly in the Western world, and allergies are just increasing all the time. I mean, hugely. I mean, in America, they're pretty convinced that within a very short space of time, half the population of America will have one or more allergies in their lifetime.
Yeah. I mean, as you well know, my sort of particular area of interest is sort of skincare and cosmetics, and well, I've felt like kind of running to the top of the hill and shouting "I told you so" at the recent press reports that you will have seen about the the allergy epidemic they're calling it because of the chemicals in cosmetics. I mean, I have been telling people for years.
And I know it's important. But I came across a lady that used to come out in urticaria, nettle rash, and she described it, though I never saw it, as bunches of grapes. Mm-hmm. And she used to change everything. She was going for hypoallergenic shampoo, different shower gels, soap, etc. And it still happened. And it really puzzled me. And it wasn't, and this was years ago, and it wasn't until she said to me, well, I'm going to stay with my mum, so I won't get it there. And I said, well, why not? And she said, well, probably mum's cooking, and I'm used to that. And I thought, well, maybe. And she said, I don't get it when I go on holiday either. So I thought, what's the one constant? And I tested her for tap water, and it proved positive. And I treated her just for her tap water, straight from the tap. And her urticaria went. She never had it again.
Yeah.
Which is really strange, isn't it?
Very strange. Yeah. I mean, I guess, as you say, this is just, it's a massive topic. I mean, we could talk for several more hours on it. Let me just get a couple more of these questions in quickly, actually. Jane says, is it possible for my infant to be treated because she's only 6 months? We don't know what the allergy is, but can you treat babies?
Yep, no problem. Absolutely no problem whatsoever.
Would you sort of use the parent as a kind of surrogate, as it were?
Surrogate, yeah. No, absolutely. Yeah. Yes, we do. Yeah.
Yeah.
And
okay.
it works fine. In actual fact, it works better on young infants and dogs and horses because they don't have any sort of cynicism towards it.
Well, let's just look at that cynicism for a moment then, because obviously, I mean, we've made a few jokes about it, and it was Helen, I think, said, you not that many years ago, you'd have been burnt at the stake. Probably I'd have been there beside you.
Yeah.
But how?
Well, at least we'd have been company.
Yeah. How do you? Well, I mean, how does I'm not even sure what my question is. I just wish that there was a way of sort of helping people get over that initial skepticism. Well, interestingly enough, you have come up with one way, because I think what you're offering at the moment is a money back guarantee on your treatments. Is that right?
Yeah, and a free consultation. Yes, we are. Yeah.
Yeah. Explain to me how that works then. What you're offering.
Well, we're offering a free consultation, so someone can come along. We'll explain their situation, tell them what we believe the underlying cause is, and give them a sort of prospect for a prognosis for how it might go. If we're wrong and they've still got their allergy at the end of 4 sessions, because I like 4 negatives, then we give them their money back.
Well, that sounds very generous, because, as you say, they haven't really got very much to lose in that instance, have they? And you're based in Surrey?
Yeah, in Leatherhead and also in Harley Street.
Yeah. And are there other CKT practitioners?
Yeah, there are loads, yeah. I mean, I'm going to expand it as things go by, and we'll probably be offering this service, across the UK and in France and Norway and other places where there's practitioners.
So let's just run through in the few minutes that we have left. Let's just run through what would it be like then if someone came to you for a consultation? Because I know we've said it's non-invasive and you only have to take your shoes off, but people, if they've got no idea what it is, might not kind of, it might seem quite fearful. So, I mean, we've only got a couple of minutes, but could you just sort of explain? Presumably you'd take some kind of case history to start with, would you?
Yeah, well, I mean, what you do is you turn up, you fill in a form, you put everything on there you think is relevant. We then put you on a bench, get you comfortable, take your shoes off, and then we then do a couple of muscle tests to establish A, the trigger, and then B, the prime cause. We then explain what we found to the person and give them a sort of prognosis of how we may proceed and what they would expect.
Well, back on skepticism then for a moment. I know there are people who just believe that just the whole concept of muscle testing, is absolute nonsense. So can you just explain how that works? It's probably quite a big subject.
Yeah, well, I believe this is all a cellular thing. We have 3 aspects. We have cellular memory, cellular intelligence, and cellular communication. The cellular communication is when the arm goes weak, because it doesn't mean weak, it just means yes. And then, so we talk to the body, and it's fascinating. And when people get the hang of it, after they've maybe had a treatment for an allergy or something similar, and then they start coming in with questions, like, is my budgerigar ill? It's losing its feathers, and well, you just ask the body, and you get whatever you get. But it's fascinating stuff. I absolutely love it, of course.
And would you, so when if you have successfully treated someone and you've done your 4 treatments, as it were, would you be suggesting lifestyle changes? Sort of a big change. I mean, obviously it would depend what the allergy is, but would you be suggesting a big change in diet or the way they live their life?
Yeah, possibly, particularly if they've got a weight issue and they're having trouble losing weight. Then, we would look at that quite specifically and ask their body what's best and what's worst, and how could they lose weight progressively over a few months. I'm not talking about these crazy fatty diets where you lose, 2 or 3 stone in 3 months. Not that stuff, because from what I've seen, most people that do that end up heavier in a couple of years than they were before they started. It's just too much of a challenge to the body.
Sure. Okay, well, just to finish then, where can people find out more information about what you do?
They can go to our www.allergyfreedomprogram.com, which should be up and running. We had a few techie problems, but it should be up and running tomorrow, and they can book in there and get a free consultation and see how they go from there.
Mm-hmm. And you also have the CKT website. Would you like to just give
we
us
do,
that address?
which is it's being restructured at the moment. But if they go to Allergy Freedom Program, they can gain a lot from that.
Okay, so just give us that address one more time.
Or to Vital Body Health.
Okay, just give us that address then, David, in full, the Vital Body Health one.
Yeah, it's just www.vitalbodyhealth.com. janeyleegrace.com, and there's a load of videos on there from people that have had the allergy treatment.
Great.
On the YouTube, that stuff.
Well, it's been absolutely fascinating to talk to you. I mean, anyone would think seriously that we'd that certainly you'd paid some of those testimonials, because they couldn't have been more satisfied customers, could they? And
no, that was rather
that's
nice,
just really, really amazing to hear sort of success stories like that. So I really appreciate you taking the time to explain it all to us, and I really hope you continue to have more success with the work that you're doing. So actually, we should give a really quick plug to your book as well. I bet you'd forgotten to plug that. Do you want to take the last 10 seconds to plug your book?
I'm not a very good plugger. Yeah, I've written a book called Every Woman's Guide to Vital Breast Health, and the idea is that you do this before you get a problem. Don't wait until you get a problem. And it's very helpful, very supportive.
It is. It's extremely helpful. But what I like about it is the fact that you make it really clear which foods are alkaline and acid, and you really kind of make things very obvious, as you say, preventatively, which is, fantastic. So, David, thank you so much for your time, and thanks to everybody listening in. Our next Spotlight interview will be about natural skincare, interestingly enough, looking at 100% natural skincare. And we'll look forward to seeing you or talking to you all very soon. To find out more details of when that will be, just go to janeyleegrace.com and click on Natural Living Spotlight Interviews. Thank you so much for being with us.